Every year, millions of U.S. residents travel to countries where malaria and other diseases are spread by mosquitoes. Insects spread disease. The mosquito is known for its transmission of malaria, yellow fever, the West Nile virus, and dengue. Mosquitoes that transmit malaria are generally night biters, whereas the type of mosquitoes that transmit dengue, chikungunya, and yellow fever are generally day biters. Peak biting times are in the early morning hours and the late afternoon. Mosquitoes that transmit the West Nile virus and Japanese encephalitis are most active at dusk and again at dawn. When it comes to preventing malaria, anti-malarial drugs are very effective, however they are not 100%, which is precisely why you need to use something else. In addition, using insect repellents and other preventive methods are very important to prevent mosquito-borne infections that can cause serious illness and even death. Start by wearing clothing that exposes as little skin as possible, such as long-sleeved shirts, long pants, and hats. For added protection, pre-treat your clothes and bed net with a product that contains permethrin. A bed net will protect you while you are sleeping. The best and the most important measure is the use of insect repellent. The most effective repellents contain DEET or picaridin. DEET and picaridin have both been tested by the EPA for safety and effectiveness. The same cannot be said for other chemical or herbal repellents. The ideal concentration for DEET is between 30 to 35%. Do not use more than 30% on a child. For babies under 2 months, use netting only. The ideal concentration for picaridin is 20% or greater. The main difference between DEET and picaridin is that picaridin has a pleasant odor. How to use insect repellent safely and effectively. First and foremost, read the label and always follow the directions that are listed on that label. Remember that insect repellents have a time limit. The directions on the label will tell you when you will need to reapply. Apply sunscreen first before applying your insect repellent. Spray the skin of your body that is not covered by clothing. Do not apply insect repellent to the skin that will be under your clothing. Heavy use of insect repellent or pouring it all over your body is not necessary. Repellents should not be inhaled or ingested. Never spray insect repellents directly onto your face. Spray insect repellent onto your hands first, then pat the insect repellent onto your face. Wash your hands after applying insect repellent to your face. Never use insect repellent on wounds or irritated skin. After returning indoors, wash the insect repellent off of your skin. Bathe with soap and water. This is especially important when you use insect repellents daily. If you develop a rash or a reaction to an insect repellent, wash the area immediately with soap and water. Avoid further use of that repellent. If you see a doctor about that reaction, make sure to take the repellent container with you. You can also call the poison hotline at 1-800-222-1222. A travel medicine physician is a great resource for more information. Your travel medicine physician will prescribe the vaccines and the medications that will optimize a safe travel experience. If you are pregnant or breastfeeding, talk to your doctor about the right insect repellent for you.